Is this on? Yeah. Comrades, you'll be pleased to hear that I'm going to do this very, very quickly, because we could, have a conference on healthcare on its own and all of the other issues that we have been discussing. I've dropped this up in short sections. First of all is the daily crises that confront patients and clients in their day-to-day dealing with the health service. To say that patients and service users experience frustrations and indeed struggles trying to access healthcare in Northern Ireland is not an exaggeration. And sadly, citizens often are very reluctant to complain or criticise the shortcomings in the service out of loyalty both to the NHS and indeed to the staff who deliver against all of the odds. The staff at the coalface who deliver against a backdrop of staff shortages and major cuts and major relocations of services, and the Meg has fainted there, without actually any consultation to either staff indeed or patients, and the total lack of consultation with the wider public. I'll deal with the various sections of the healthcare system, and this is just those who deliver care, so nobody jump up and say you left this whole myriad of people out. And the first one is the first point of contact that we have when we actually go seeking healthcare is with the GPs. That's called primary care and other related services, and they should be the first point of contact for anyone seeking help in the health service. Primary care actually accounts for a substantial proportion of the overall health and social care budget. Yet we know that people on a daily basis are struggling trying to get GP appointments. And actually, COVID has not only covered this up, but in fact it has normalised it. Our GP system now works in a totally different scenario. GPs will tell us that many of their colleagues are retiring because they are burnt out. And that is the cause of actually the major problem. Another major cause, I believe, and the party believes, is that GPs are independent contractors. They do not actually work, or while they work within the healthcare system, they are not direct employees of the health service, and this is a major and a big problem. There's also widespread confusion over the notion, and we've been listening to it in the media, where GP surgeries are closing, and now the Department of Health are saying we are experiencing difficulties in getting contracts. A GP, I think it was up in the Western Board, they actually got somebody from England to contract with them to take over surgeries. Now, you have to ask yourself, is actually GPs and the system treating patients as another commodity to be bought and sold to either the highest or the lower bidder? And that is a major problem for us. Social care and related services, those are services which consist of social work, domiciliary care, occupational therapists, etc., and other health care providers. Now, they were set up, and the original sort of notion of all of this was that people could be treated in their own homes with these services, and that was to stop them either being admitted to hospitals or being in hospital for long periods of time, or to be gone into nursing homes or indeed residential care. The problem with all of this was that for a number of years now, the system, when they needed to cut budgets, has seen these services as what you would call low-hanging fruit, that you can go in, grab money out of the budget, and nobody would notice that you have did it with that. Under transforming your care, both domiciliary care and residential care has been totally privatised. And that means that the most vulnerable in our society are being treated like a commodity to be bought and sold at the will of either the statutory sector or indeed the private sector. Hospital, can I just grab a drink of water?
Yes, sure.
Please. And I know that's not my medication that's making my mouth dry up. It's an overuse of it. Now I'm allowed to say that, none of yous are. Right, hospital and emergency care. Hospital services account for the majority of the overall budget within the healthcare system, and they should provide a full range of medical and surgical services through planned medical admissions, elective surgery, and emergency admissions and GP referrals. Over the past decade, hospitals have staggered from one crisis to the next and have been the subject of many reviews, including a major one by the Human Rights Commission on unscheduled care. Unscheduled care is the care you get when you arrive in the ambulance, and it's emergency care. And if all of the other systems aren't working, when you get in the door, you've nowhere to go when you're in the door. So you haven't. Yet nothing has changed after all of these reports, etc. The service isn't much better off. Problem's been blamed now on COVID instead of the lack of proper funding and an unwillingness to engage strategically with either the staff and their unions or indeed political parties and service users on how best to deliver the service that we need. We've had review after review after review, and the one thing we can say with any degree of certainty is that each time they do a review, they make the service worse. Like transforming your care, that's had its name changed now because it's a dirty word, transforming your care, but they just go and they call it something different. Nothing has genuinely changed. I mean, the Bengal report has come out, but if you read through it, it's actually transforming your care, shifting services, outsourcing services, and all under another name. I mean, when they talk about the third sector, they don't just mean the voluntary sector, they mean the independent sector. The drive to cut budget, staff, close beds, departments, and privatise services has led to the meltdown of the system. And it's no doubt the system is in meltdown. The system is broken, but it wasn't broken by accident, it was broken by design, by the very people within the health service who were charged with the responsibility of running it on behalf of our citizens. The impact of that design: health inequalities have drastically increased as medical conditions have worsened due to the lack of treatment. Abject poverty is now rife in areas of deprivation, and mental health problems have reached pandemic proportions. Waiting lists have reached an all-time high. Trolley waits have not only increased, but they have become the norm. Beds are blocked because of the lack of care packages, because of the rush to privatisation. And the private sector is growing and sees the suffering of those on waiting lists as an opportunity, as a cash cow to be milked at every given opportunity. What are the solutions to the well-published problems? Because we all know the problems. Now let's look at some of the solutions. And this is where you all get your homework to do. And you all get to say, we would say quite rightly that only a socialist society can restore the NHS to its founding principles. A health service free at the point of entry, regardless of class or creed or the ability to pay. Nye Bevan, in his book In Place of Fear, give hope actually to working class people who couldn't afford health care. But those principles have been undermined and attacked not only by Tories, but from some, and they're not just a small handful, by many within the healthcare system itself, have actually worked hard to ensure that we no longer have a national health service, because many of them think it's an outdated notion. that actually it has served its purpose, that the way to go is either the American system or indeed the system in the south of Ireland, where actually insurance is the way to go, and private insurance. As a party though, our focus quite rightly remains on restoring those principles and ensuring that a health service is fully funded through taxation. But in the short and the medium term, we'll have to look at how we can overcome the problems that exist and the immediate problems. How in the meantime can we provide an improved service for the citizens? Would a Bill of Rights be a core element of that improvement? Should GPs be required to become employees of the NHS? Should hospital consultants and others who currently do work for the private sector and indeed the public sector, should we require them to make a choice, public or private, not both? I think we should. Should all privatisation and outsourcing of any services be currently stopped, and those services that they have outsourced, should they be taken immediately back into the statutory sector? Do we need all future policy decisions to have full equality impact assessments and to stop the practice of high-level government equality impact assessment, which always come back saying the same thing? There is no discrimination, only against the working class, and that seemingly is quite accessible. Do we need to ensure that all future policies have legislation and a revenue tail attached to them, so that we can have legislation that guarantees and ensures that these policies are implemented? We have heard people discuss all morning that there has been this policy and that policy. I think they're probably in a corner somewhere with our Bill of Rights in a wee cupboard gathering dust. And we need actually legislation to ensure in future that the policies that come out are implemented and funded. Do we need to look at how we currently deliver services and how we can actually enhance those services? That's a discussion that needs to be had, not only within the service and not just by the vested interests inside and outside of the National Health Service. Do we need to ensure, and we've had a number of contributions on this morning, do we need to ensure that in future government engage in joined up thinking around all of the delivery of all of the public services? Because we have example after example. This morning we have been talking quite rightly about joined up government. If we as citizens can talk about joined up government, why can government not talk about joined up government and not have actually each department as a fiefdom, all of its very own? There needs to be joint thinking in all of this. In fact, a few years ago now, Manchester Council did a project where all of the services, police, actually education, social services, health and all came together, and they pooled their budgets. And actually the money was distributed according to the needs of each of those things, because they recognised there is ill health, homelessness, as Trevor has said, and all of these things are not individual instances. They're actually all fed into each other. I mean, if you've no home, you actually are in poor health. If you've no food, you're in poor health, and you're actually homeless. So it all links into each other. And if we can see that, why can the powers of be not see that? And now here is the interesting one. Do we think that our current political system helps or hinders the delivery not only of the health service but indeed public services? I hope we're going to come up with all of these solutions, but it is time that we not only stated the facts, but that we looked at how best to deliver those changes. And they're not rocket science, it's just that our politicians don't seem to be able to cope with the most basic and simple concept. Thank you, comrades.
We've seen at conferences or in party papers for a long, long time, and if Lily's willing, I think we should share that with people by email and so on afterwards. I think just a number of very quick points. First of all, I think we should be absolutely sure that the NHS is under an orchestrated attack and has been since 1948. From the day and hour that it was brought into being, there were think tanks and right-wing lobby groups and vested interests who were determined to dismantle it and carve it up for profit, and that continues, and maybe it's made more progress in the last 10 years than it has in the previous decades. But this is not an accident. An emergency, yes. An accident, no. And that was a point well made. I think the other point, two other points I'd like to make is, first of all, we need to stop thinking, and when I say we, I mean policymakers and government and administrators and legislators need to stop thinking in terms of an ill health service, which is what we have. We wait for people to get sick and then we try to cure them. What we need to do is have a healthier society, and that comes back into all the things that you said about joined up working and linked government. You stop people getting ill by making sure that there's good and adequate housing and affordable housing, that childcare is available to allow people to go to work, that people have proper diets, that people don't suffer from mental health problems, and so on and so on. That's how you create a healthier society, and if you have a healthier society, you have less stress on your health service. But the final point, and really, you're absolutely right, Lily, we could go on all day, all week on this, and I certainly on this particular topic could, is the whole issue of social care or care provided in the community. I think it's a grossly misunderstood concept. It's been undermined and ridiculed by the media and by certain vested interests as well. And on a good day, I would think that the Department of Health and the Assembly don't understand it, but I think the reality is different. I think they do perfectly understand it. As you said, it's been a useful cash cow to raid. If you're looking for a budget rate at the end of the year, we'll take it out of community care. But community care is not just about getting people out of hospital. It's about people with physical disabilities, sensory impairments. It's about providing services and support in the community for them to make sure that they have a dignified and full and quality life for as long as they have that. And yet, even in the 21st century, community care is a secondary consideration, particularly when people get old. The response to this society, to older people, and the ageing population is increasingly used as a reason why the NHS is in the difficulties it is. Nonsense, but anyway. But our solution, and again, our being society's solution for older people in particular, is to stick them into care homes. And if in the 21st century that's the best we can do with an elderly population, then we need to take a serious look at ourselves. Because the possibilities to provide first-class, world-leading, exemplar community care exist in Northern Ireland, exist in this community, and there have been examples of it. And they've been stifled by the department level, they've been stifled by health boards and stifled by the John Comptons of this world in favour of the white coat and the stethoscope model of healthcare, because health is all about hospitals in their opinion, and that's because they're pandering to vested interests. I mean, maybe one day we'll get round to writing the definitive paper on community care, and we should, and maybe I should do it as well. But it's an important point to make and to take away from today. Thanks.
I'm going to take one now. Sorry for telling you that it's just a serious amount of time now. Owen.
Yeah, just very brief point again. Thanks, Lily, for your succinct and very good summary. Just as something Brian had just picked up on, I'd encourage everybody to watch John Pilger, The Dirty War in the NHS, which is factual evidence documentary on the war by the right, capitalism against the NHS since 1948, when people came back from the Second World War, land fit for heroes, and the creation of a welfare state. They've been undermining that from the very beginning, and have all but succeeded in creating a United States two-tier system where you'll have a small tiny rump which may retain the name NHS and will be for those, for the likes of the rest, for us, the working class, a very inadequately resourced and funded medical health service like America, and then you'll have a more enhanced medical provision for those who pay private insurance, and that seems to be on its way. It's already in the Republic of Ireland. I work in acute psychiatric services inpatients, and in June 2019 we experienced a modernisation, a so-called modernisation which took all the mental health units in Belfast, shut them down. We got a new build in the city hospital, and again, not by accident, we found ourselves 8 beds short. Now, that may not seem much, but it immediately plunged our services into a bed crisis with a new hospital with people sleeping on sofas, right? So that was cut deliberately, yeah. And there's been an ongoing regional bed crisis and acute mental health services since that point, where we have to send patients out of trusts, and all the other trusts, western, northern, southern, southeast, are in the same boat, so their patients been moved here, there and everywhere. In fact, our service is good, what we provide, but we're hampered. We're actually completely restrained, and then beds are getting blocked. And the other factor that's blocking beds is that they're not the community resources for patients to go out to. So they have to stay in, and they are delayed discharges, you know. Or if they're homeless, they're getting sent out of the area up to places like Derry where they've got no social contact, their mental health deteriorates, and they rebound back into the system again. You know, it's a complete failure. And again, we look at places, you talked about the GPs, and they're private contractors. In Cuba, you have, for example, you've got a GP, state-employed GP in every area. Literally every housing area has their GPs, you know, and they're paid for by the state. In fact, Cuba is medically training nursing students from the places like Manhattan for free. They come and they get trained in Cuba, and then they go back to America, you know, where they can't get their training in America. So again, we've got a small socialist country in the Caribbean that's under embargo, that is able to deliver the best health service to its own people, and internationally. The Henry Reid Brigade going and delivering top quality health service internationally. We could probably do with coming here and helping us out. That's all I'll say. Thank you.